The PRIMA trial is a study that was actually completed now almost 10 years ago. And we have now long-term follow-up, and that was presented of the use of Rituxan or rituximab maintenance in patients that receive chemotherapy in combination with rituximab as frontline treatment for follicular lymphoma. And the PRIMA trial looked at the use of rituximab maintenance compared to observation or no maintenance and showed a significant advantage for receiving rituximab maintenance. Patients in that trial received 2 years of maintenance therapy, and with long-term follow-up, the data shows that there's continued improvement in the overall outcome of patients who receive maintenance therapy. And it's also safe, and the long-term complications and toxicities are well managed and actually modest. So the trial that Dr. Rummel and colleagues presented now looked at should you or could you do better if you actually gave 4 years of maintenance therapy versus using 2 years of maintenance therapy. And what were the side effects and toxicities as one utilizes this approach. As it turns out, there may well be some merit to a longer course of rituximab treatment. But I think at this point we're going to need to see whether that's something that is going to be incorporated into practice across the board.
My clinical practice in terms of maintenance rituximab is such that I have a discussion with the patient about the benefits and cons of maintenance therapy. In general, I talk about not only side effects, but the progression-free survival benefit and the lack of overall survival benefit, as well as the potential to reutilize Rituxan in the future in patients who don't use maintenance therapy. There is no singular guideline as to when and how to use this, but once again, I would say that in those patients who have limited treatment options, again, for an example, a patient who is elderly in whom you think second or third line therapy is not practical, Rituxan maintenance may be particularly important. On the other hand, patients who have a good response to induction chemotherapy and are not inclined to come on a two-monthly basis for a continued treatment, or who have side effects from rituximab, would not be ideal candidates for Rituxan maintenance, in my opinion.